Everyone, and welcome to Dr. Rachel Allen-McHugh's presentation. Dr. Rachel is an Infant Massage USA board member. Woo, yes! And she has over 20 years of experience serving children, caregivers, and community members in a variety of practice settings. Her primary area of expertise is pediatric clients. Now, her work as an occupational therapist has been both in Europe and the United States and has enabled her to develop a unique perspective of therapeutic use of self by building relationships with diverse communities. Dr. Rachel has been a certified educator of infant massage since 2003 and has used it with children and families with her work as an early intervention pediatric occupational therapist. Her current interests as a Drake University assistant professor for occupational therapy doctorate program, include health and wellness promotion, youth, student learning, and community engagement. And she is here now to engage our community through this conference, helping everyone that we can. So Rachel, I will leave it to you. Thank you so much.
Wonderful. Thank you, Stephanie. I hope everyone can hear me okay. I think so. I've just been watching some people chat. I love watching the chat, but I know I have to try to present at the same time. So we'll see how this goes. But again, just to let you know, yeah, I'm an OT. I've been an OT for over 20 years, primarily in the area of pediatrics. And I found infant massage early on in my career and used it as a tool, not only to support our little infants, but also to support our caregivers in supporting their competence and also their confidence in managing their infants. And so I just love infant massage, and I'm just going to talk a little bit about it today for you all and how I use it as an OT. All right, let's see if my slides will go. Okay, here they go. All right, so our objectives today. For some of us in the room, I see Mary. She said she's an OT. Hey, thanks, Mary, for joining this session. So I have some questions about OT, so you're not allowed to answer because you will get them all right. Hey, Donna, I see you. Nice to see you. She's my champion there, Donna. Thanks for joining my session. Anika, is it, in Minnesota? All right, we got some OTs. So if I throw out any OT specific questions, you guys can't answer because we got to challenge some of the others in the group. Okay, here's our objectives. We're going to talk a little bit about sensory systems, some research that's out there, because I love grounding what we do in evidence to prove to everyone that yes, massage is powerful and we have the proof. And I'm going to share some case studies, specifically some things that I have done or some of my colleagues have done in using infant massage to support infants and families, just some things to remember. And then, yeah, and we're just going to have a great time. I think this hour is going to fly by, so I better get moving. All right, occupational therapy. In the chat, go ahead and throw in the chat, what is an occupational therapist? Let's see, you guys. This is your quiz time. What is an OT? If you have to say it in one sentence, what is an occupational therapist? Ooh, the chat got really quiet. What do those OTs do? I saw someone say, ooh, OTs are very important to the team. Hey, Laura, what is an OT? We don't find jobs for children. That's right. Thank you for that hint, Mary. That was good. Yeah, an OT helps people live meaningful lives, focuses on many things: feeding, sensory regulation, helps with activities of daily living, treats the entire body, helps patients function in day-to-day activities, smaller movements of the body. Wow, okay, everybody is putting in some awesome answers. You are on the right track. Yes, what is OT? Occupational therapy, we enhance active engagement, participation, performance, and function in meaningful roles, habits, and routines in various settings for our clients. We enhance our clients' participation through the use of client-centered and occupation-based interventions. And so that's what our association says that we do. It's all for our clients, based in what is meaningful for them. That's right. Trained to help people do what they want to do, right? That's what a great job. And so what is occupation? And no, occupation is not just going out to find a job, though there are some OTs who specialize in getting some people back to work. And occupation is really broadly defined as any daily life activity that is meaningful, valuable, satisfying to an individual, to a group of people, or even to a population. And so occupation has a pretty big scoping, inclusionary meaning. So an occupation is wonderful. It's whatever we do during our day. And so our infants have occupations, right? Our infants spend their time eating. That's one main occupation. They spend their time sleeping, another main occupation, and playing. And as our children grow, those occupations also expand to include self-care and education. And so as people grow even more and grow into young adults, our occupations expand out to leisure activities, to work, and also out to health management. And so there's kind of 9 formal occupations that have been identified by the AOTA, or our Association of Occupational Therapy. And so, but really we zone into, for our little infants, eating, sleeping, and playing are our main occupations that we're using. Yeah, play is the work that children do. Play is hard work. All right, our sensory system. So in the chat, what is the first thing that comes to mind when you see those words, sensory system? Or sensory? Touch, awesome. Sensory integration, body feelings, the way our body feels. Seeing, yeah. Smell, hearing. Yeah, that body communicating with the brain, excellent. The 5 senses, taste, right. Awesome. All right, we're on the same page. So our sensory systems, yeah, we have those top 5, our sight, sound, smell, taste, touch, but we also have 3 other kind of hidden senses that maybe we aren't really aware of until we start talking about them and think, oh my gosh, those are totally senses too. Our movement sense. So anybody ever been on a roller coaster? Laura, you seem like the type of person to be on a roller coaster. Have you been lately? No way. Why not, Laura? Why haven't you been on a roller coaster lately? Vestibular. Oh, awesome. You even know the word. Vestibular. Yes, that movement sense. Our vestibular system is based in our ears, in our semicircular canal. So when we run around in circles, right, or we are on something that spins us around, we get dizzy. And it's our vestibular system that's trying to protect us and telling us to stop. We're going to hurt ourselves, right? So not everyone has a vestibular system that is telling their body where it is in space at the correct time, or how it's moving in space in a correct way. So sometimes we may have some vestibular sensory input that is not being processed correctly. And then pressure position, I saw proprioceptive. Annabelle was jumping into proprioceptive. That is that pressure, knowing where our body is in space. And I think, yeah, being on that roller coaster might challenge some of that proprioceptive sense as well, because it's pushing it when our body pushes against things, when our feet press down into the earth, when we're climbing, when we say, hey, can you give this person a hug? We know just the right amount of pressure to give without squeezing them too hard. That's that proprioceptive sense. And then finally, I saw this mentioned before earlier in the chat. Let me see if I can move the chat. Oh, I can. It said body feelings. And there was something else, another one that I saw. That body communicating with the brain. Yes, it's so embedded in emotions. Yes, that interoception. It's internal feeling of our body. So, has anyone had some GI issues? And you know, when you have GI issues, you are not thinking about anything else but what's going on in that belly of yours, right? And so sometimes our kiddos, they struggle with interoception. Their body is giving them messages from the inside, and they don't necessarily know what those sensory those sensations mean. They can't identify, like, when I feel that in my belly, that means I need to go to the bathroom. Or when I feel that in my heart beating really fast, that means I need to calm down or take some deep breaths. And so it's that interoception sense that is so important in getting our children, our youth, and our adults to be able to feel a good homeostasis and be able to think and function and go about their everyday activities. And so there's our sensory systems there in front of us that are so important, that I feel are impacted by our infant massage. And so when we look through the lens of occupation and occupational therapy, infant massage is considered an activity to support occupation. And it is included under the complementary health approach. And so we have a white paper with the American OT Association about complementary health approaches and integrative health, where infant massage is supported as that activity to support occupation, as something an occupational therapist can do to support their clients. And so, like I said before, we know we're all at the infant massage conference, right? We know the power of infant massage, but sometimes we need to be able to back up our practices, our beliefs with some evidence, right? And so I'm going to refer to just some research that's out there that tells us that yes, occupation or infant massage can be used by occupational therapists as an evidence-based practice. And so there was a study completed, well, a couple studies, one in 2013, one in 2008, 2012, 2015, that all of these studies here have come back to say that massage used as a sensory-based intervention has been shown to reduce maladaptive or negative behaviors in children with mental health conditions or autism spectrum disorder. So that just off the bat is telling us that infant massage can be used, or massage in general, that deep tactile input can be used to help reduce maladaptive or negative behaviors in our children. It's also been found that touch-based interventions have enhanced social emotional development and psychological stability among our infants. It's also been found to reduce aggressive behaviors and social problems in preschoolers. So just knowing that power of touch is so important, those touch-based interventions. And so in another study, both Lambert et al. 2017 and Harrison 2020 have found that touch-based therapy such as infant massage is a beneficial therapeutic intervention for infants with cardiac defects, and current studies state that it is safe and feasible intervention for fragile infants that may be linked to increased physiological outcomes and reduce pain. And so what that's telling us is that infant massage can be used for those high-risk infants that may have failure to thrive, may have difficulties gaining weight, may be experiencing pain, that infant massage is supporting the growth and development of those infants. One thing to remember, though, is that there is evidence out there that cautions us against using infant massage in our traditional infant massage in the NICU. We have to be very purposeful and planful in the NICU for our infants, because our little infants in the NICU do not have fully mature sensory systems yet. And so any type of full infant massage program may be too stimulating for our infants in that setting. So we would be wanting to be doing some real precursors to infant massage, maybe just placing and holding hands on our infants at that stage. So then when our infants get older and are at that adjusted age of around that 3 months, it is appropriate then for us to come in with our infant massage touch-based therapies. All right, so just to summarize that little bit of research that I pulled for you is that OTs who provide touch-based interventions, such as massage, need to educate other healthcare professionals about the intervention. And so we need to say that not only are we doing this massage, it's not just a massage. We are educating our caregivers to both empower them so they feel confident handling their babies, interacting with their babies, and are competent in how to do that. We also want to provide additional parent education to support those family-focused participations. It's not our role to be completing the infant massage. It is our role as OTs to be training the caregiver, empowering the caregiver to support that development of their child. And so Flynn came and tells us, really recent study here, 2022, that the approach that Infant Massage USA uses to educate parents and caregivers is the most ideal. This study recommends that education should be done, and it should incorporate verbal instruction, which we provide in our trainings, paper handouts so that our parents have those step-by-step directions on the strokes, and then even video and pictures for parents to maximize use of the therapeutic intervention. And so Flynn also found that our parents and therapists may also find it beneficial to participate in that immersive learning workshop. So if they can actually attend an infant massage workshop, that it would support delivery of the intervention even more. All right, why don't we pause right there? And I see a question in the chat. So babies with cardiac issues should do infant massage after 3 months adjusted age. And so what we need to do, we always have to make sure that we're following any recommendations of our doctors. But when I was saying earlier, we wouldn't be starting infant massage with a high-risk infant any sooner than what we would be doing with our own infants when we're doing infant massage. And many times, if we have a child that is at high risk, we may need to wait a little longer until we have that permission. And so that adjusted age of 3 months may be the most appropriate time, but I don't have research or anything to back up that is what you should do. We should always follow recommendations of our doctors if we're working with a high-risk infant, infant with cardiac issues. If the infant was also premature, we need to be considering all of those things. So we just can't, Amy, really say that that 3 month is just like a blanket okay. But in my experience, waiting a little bit longer is usually beneficial. We want to make sure that even though the infant is fragile, that they're stable. And that our pediatrician or the cardiologist is also aware and on board of what we may be doing with our child and our infant. And as you know, we can also modify our infant massage approach too. So maybe we are just starting with strokes, and we're not doing the full 10 strokes and all of the strokes. It may be stretched out a lot longer over time. Yes, exactly, Donna. And we have places to begin, such as with skin to skin. And so if you are working with that cardiac infant, you may not jump all the way right into that infant massage. Similar to what we do with our infants in the NICU, it may be just having those infants tolerate placing of hands, skin to skin, placing of hands on the face, because many of those infants have had some traumatic experiences medically due to maybe surgeries and procedures. So we always have to keep that in mind when we're doing any kind of tactile input, because to that point, any tactile input that they may have experienced may have been really negative. And so we always have to work very slowly with them. Yeah, thanks, Donna. Absolutely. All right, great questions. Thank you so much. All right, so let's jump into some case studies. So the way that I divided these case studies was along tiers. And so when I think of tiers, I think of tier 1 as being universal for everyone. And that really incorporates our traditional approaches and education in infant massage. And so when we maybe are hosting infant massage in a community setting, maybe you have an infant massage practice on the side or business on the side that you are providing infant massage to, most likely are typically developing infants. That is our tier 1 approach, that we're really providing this amazing service to the community. And so we're having community members engaged at that time. Tier 2 is more of an at-risk population. And so maybe it's not somebody who's been referred to you for occupational therapy services, but you have been asked to do infant massage training for a parent group of graduates of a NICU. And so you may not have these infants on caseload. They all are meeting their developmental milestones, but there's still a group and they've graduated from the NICU, and they may have a parent group as just a support group to help with these infants. With that said, this is still an at-risk population because of the experience that they were born prematurely and had spent time in the NICU. So having that in mind, you know that everyone in that group has had that similar experience and are similarly then at risk. So then we have that tier 2, that special group that when you go in to instruct those groups, you are looking through that lens of everyone in this group has had a NICU experience. Okay, what are some red flags that I should be looking out for? What are some precautions that I should be taking? What are some additional information or resources that I should be providing specific to the NICU and development to this parent group? And then finally, we have our tier 3, which is more of that individualized instruction. This would be the infants that I saw via my caseload as an occupational therapist. So they were referred to me for occupational therapy, many times through the early intervention or early access system. And so I was an early intervention therapist working in the state of Iowa, and I carried a caseload of infants ranging from NICU graduates, so our newborn infants, to just before their 3rd birthday, where they would shift from early intervention into a school-based possibly setting. So that was my range there. And so they would, every case then would be individualized. And I found many times with that caseload, I was pulling in strategies from infant massage to help support the development of these infants and access to the infants' occupations. All right, so let's get a little bit deeper into this. So our community, like I said, it's that traditional infant massage setting. Caregivers and infants don't have a diagnosis or condition. Many times delivered as a part of a health promotion or disease prevention group. Maybe you're at the community center. Maybe there's a local YMCA and they want to sponsor you to provide, classes for ongoing classes for infant massage. And so that is where you are just interacting with people from the community. And so I have been involved in a baby bonding group for new parents. And so several places actually, just with my work as assistant professor now, I have brought infant massage training to the university that I work at, Drake University in Des Moines, Iowa. And so that our students here had the option of pursuing that training. And then by pursuing their certified educator of infant massage training, they then had to complete their own groups. And so one example of that I helped to oversee was a group at a chiropractic office that there was a local chiropractor who had a caseload of young parents and infants and was really interested in infant massage and supporting an infant massage group. And so that was done there. I've also held a baby bonding group for new parents at a local studio that I instruct at. So I'm also a yoga instructor. And so this was a perfect location for some of our new parents to get out and have some of that caregiver bonding, get to meet other people with infants and do some instruction there. And then there's also a new parent group starting up at our local children's museum and they're very interested in having infant massage added to their calendar to support their new parent group there. And so there's, as you all know, loads of opportunities. But as an occupational therapist, I'm always kind of looking through that lens. And many times there would be someone who attends the group that possibly may need to shift into one of our other tiers. And it's important as an occupational therapist to be looking for maybe anybody that might be at risk and helping to support those new parents with recommendations on how to meet the needs of their infant. And so referring on, telling them to touch base with their pediatricians with the concerns they're having, look into maybe early intervention services and maybe more specialized groups specific to the needs and challenges that they're facing. All right, our tier 2 group, again, like I said, is that at-risk group, similar to what we would have at the NICU. And so I also had a student who was trained in infant massage, and she did a capstone at a hospital that had a NICU. We did not incorporate infant massage in the NICU because of the concerns with infant massage being implemented there, but we did our preparatory work there, such as our skin to skin, our holding and our placing of hands, instruction of our caregivers. And then she helped to establish a parent and infant group for the graduates of the NICU. And so she was able to go in with a really specific curriculum, not only aligned with the infant massage curriculum, but also topics sensitive to what our NICU graduates may be encountering. So concerns around feeding, concerns around sleep, concerns around any kind of colic or GI issues. And so she has some really specific topics sensitive to our infants and caregivers who had been who had experienced the NICU and then had graduated from it. And finally, our tier 3. I just have endless examples for tier 3, but I did choose one about an infant who was diagnosed with Down syndrome, and this infant also was a graduate of the NICU and had some high risk situations, and then also would be considered to have cardiac needs as well. And so I provided a real individualized approach to this family. So one occupation that I addressed first was sleep, because of the infant's difficulty with with regulation. So we talked about co-regulation, how the caregivers could use their own bodies to help co-regulate their child, to help them calm. So using holding, skin to skin, placement of hands, some movement, some shushing, swallowing, or swaddling, just really taking in consideration all of those sensory systems to help with that regulation. We also looked at feeding because this infant had spent quite a bit of time in the NICU and had some surgical procedures. The infant did not like anything on or around his face. And so we did work on just placing of hands and working on infant massage, where the child would just tolerate placing on the forehead. And then the child would tolerate strokes just on the forehead. And so really slowing down the progression of our infant massage strokes to meet the need of the infant. And so I was able to support that family in helping the child tolerate touch on the face, and then exploring toys, then oral motorly, and then moving to feeding and eating safely. With play, because of some cardiac surgery, the infant, once approved to start prone work, didn't want to be on their tummy. And so I found that the chest massage really helped with this. And this is a great picture because it is just a visual of one of our strokes there. But just even completing the infant massage strokes where the infant could lean back against mom and help with that co-regulation, that he could feel her body, hear her heart rate, probably her breath regulation and respiration. And then dad could do the infant massage strokes on his chest with that great eye contact and interaction. So it was a really great example of co-parenting and co-regulation and use of infant massage strokes to support the occupation of play. And so it's just really that precursor to tolerate pressure on the chest, and then moved towards playing on the tummy and building up the strength infants need in their core to then sit and reach and move and play and do all of those fun things. All right, so let's pause there and just think about those 3 tiers. I'm going to pop back and just have the 3 tiers up so people can take a look. And any questions or examples that people would like to share about traditional approaches, at-risk population, or individualized instruction? Yeah, so Samantha has that question about, have you used infant massage and the principles on at-risk children older than 1? Most of the EI kids on my caseload are between 1 and 3 years. Just wondering if you've seen benefit from them. Yeah, absolutely. I have used them on youth or toddlers, really, between years 1 and 3. So as we know, right, it's really tricky once our infants start moving to engage them in infant massage. So I think one strategy is really that co-regulation. Can the parent understand just the process and the power of co-regulation of when you are calm, it helps to calm the infant, right? So using your own body to help calm an infant. So and even with so another example would be with that population gaining permission from our 1 to 3 year olds. And so once the toddler understands massage, they're usually really open to it. And again, it's our caregiver or our parent who is completing the massage. It's not us. Same rules apply in this situation. So we're educating our caregivers to complete the massage, to support that bonding and engagement between the caregiver and the toddler. So parent is still asking permission, the toddler is still granting permission, toddler decides when we're done, and maybe picking and choosing, like, is it something with the face? Is it something with the belly? Is it GI issues? Do we need to do the GI protocol? And so using those things to help support the functioning of our infants. And sometimes bringing in the doll works really well here too, that the toddler can do the massage strokes themselves on the doll, and then the parent can do the massage strokes on the toddler. And so that's a really great strategy as well. All right, and then I saw some other things. Enjoyed using infant massage with deaf and hard of hearing infants. Oh, I love that. I think that with the engagement, the eye contact would be really powerful. Trained in massage and school program for mini MISP practitioners, story massage for toddlers. Oh, that'd be fun to integrate. Yeah, no problem, Helen. It's a great strategy for our infants who avoid prone, and that is just getting more and more widespread. It's really why crawling and creeping have been taken out of our milestones that our pediatricians are monitoring, because kids just aren't crawling and creeping on their bellies anymore. So if we can give our parents and our caregivers strategies to help them tolerate prone, I think that they want them down there on their bellies. They just don't want them in so much distress. So using that strategy is awesome. Oh yeah, teddy bear, awesome. I love that idea. Babies with torticollis, I start with chest and arms, and we modify counting the strokes from 1 to 3. Then hands off to allow the child to process. Due to the tightness, they are uncomfortable. But teaching parent to help child so that combined with stretches and recommendations, the torticollis can be resolved. Yeah, I think, Vanessa, like how you're saying, pairing that therapeutic positive touch with other touches that maybe are stressful, right, is a great strategy, because so many times when our infants are medically fragile or have had conditions that cause them to have medical intervention, that touch is not a nice thing and it's avoided. So not only are we avoiding touch from others, the infants may stop touching and playing things and exploring things as well. And so then we start to develop, that starts to spiral on into some of our other sensory systems that aren't processing effectively. And so if we can get them early with infant massage, not only, well, let me throw this question back to you. Yes, if we're thinking back, to our sensory slide, and of course, touch, right? Therapeutic touch. So what other sensory systems does our infant massage help to regulate? And why? What do you guys think? If someone was to say, oh, it's just touch, they're fine with touch. Is it just touch that we regulate? What other sensory inputs are we stimulating, facilitating? All of the senses, yeah. Smell, sight, regulating touch, 5 senses, vestibular, proprioceptive, and yeah. I argue that we are helping to regulate all of them. And so, yeah, that deep touch gets into proprioception. And when we're massaging the arm or massaging the leg, we're talking with the infant. And so the infant gets to know where their leg is, gets to know where their arm is, gets to know where that belly is. When we are moving the infant through space, we're facilitating vestibular, that deep touch. We're making great eye contact with our infants for sight. They're hearing the caregiver talk and encourage the infant. And just that massage of the belly, the face, just helping with that interoception and saying, wow, that massage on my belly really helped it feel better, right? It helped it feel better. And so I just think that infant massage, even though it's a touch-based intervention, it is helping to regulate all of the senses in our little infants, and it's so powerful. Wonderful. All right. So let me get back to where we left off. So just some reminders is really out there. Occupational therapist practitioners were responsible for acquiring that specific knowledge, so complementary health and integrative health knowledge and training to ensure that complementary health approaches are safely and effectively incorporated into occupation. And so that doesn't mean that just because I'm an OT, I can just, oh yeah, that infant massage, I downloaded a handout or I bought a book and I can just do it because I'm an OT. No, the AOTA is telling us that we need to be responsible for acquiring that knowledge and training to ensure that the approach is implemented safely and effectively, right? And then OT practitioners were responsible for maintaining our continued competency. And so we need to make sure we're doing our stroke reviews and being up to date in the research that is out there so that we know what is most current. And then we are required to practice in accordance with federal and state laws relevant to statutes, regulations, and payer policies. So when we're practicing as an occupational therapist, we need to make sure that we're within our scope of practice, that we are licensed, and performing what we can do within the state. So being aware of state law. And so there are some states as we know in the United States, that infant massage is being watched, right? That we need to be very aware that of what the licensure law says and what we're practicing. And so as occupational therapists, we need to be aware of these 3 items to make sure that we are maintaining best practices. And so I just wanted to add that becoming a certified educator of infant massage has been both a valuable and rewarding experience for me. It has advanced my understanding of relationships, of rapport building, of interaction between infant and parent, and it has helped me have a tool that I could rely on to build the confidence and competence of caregivers as well as my own. Yeah, and it's supported me in supporting caregivers on their journey with those complex infants, because so many times I've heard that caregivers, they are in the NICU for 3 months and then baby is stable and discharged home, and parent is many times at home with the infant just kind of feeling helpless, like they had had so much help at the hospital with nursing and therapies and doctors, and then all of a sudden they're home alone with this infant and are feeling a little lost that they aren't capable of providing care for that infant. And I think giving them, providing them with infant massage instruction helps empower them to be a caregiver, that they have something they can do to support the growth and development of their infant. And I've just seen such a significant change in a caregiver's attitude and belief in themselves to be an effective parent for that infant. So it's been really powerful. And then here are my references that I pulled from for today's presentation. But I wanted to leave just a little bit of time for any questions or chat. I know you guys can't actually, I don't think you can talk to each other, but you can chat in the chat. So any other questions out there, any approaches or situations that were really powerful for you that you would like to share with the group, we would love to hear your input. And thank you for attending today and championing infant massage. We love it, and we believe that everyone needs to know how to use infant massage to support the development and growth of our kiddos out there. Thanks everybody for the nice comments. I just love that I was able to be here today, and I hope that you can take away something to enhance the lives of your caregivers out there. Now, I just wanted to say thank you, everybody, as you're signing out. I am based here in Iowa at Drake University, and my contact details are under the presenter information, I believe. So if you wanted to email me about anything, anything OT and infant massage, please do.